So for those friends that you know that may be interested in this program after the fact, probably within the week we'll have posted this recording of this event, as we have all of our other First Thursdays. So there is no missing this. For those that are interested, this is being recorded and will be available to the community at large. A little bit of housekeeping. I'd like to introduce our law librarian, Laura Vala Olson, who is responsible for helping us put this event on every month. Lori is our law librarian and, in our humble opinion, makes the world go round. She helps us by reporting the very things that are asked about at another event that she's responsible for coordinating. Every 2 weeks we have an event called Lawyers in the Library. And this is an opportunity for folks who have a legal question or concern to get a brief consultation with a lawyer at the law library. Since COVID, the law library suspended in-person lawyers in the library, but through Lori's efforts and efforts of other board members, we resumed this practice and are now meeting people on Zoom. We understand that it's not as personal as being face-to-face, but we appreciate the fact that people's needs did not change and, in fact, increased during COVID. So Lori and the other board members who worked to put this together have been incredibly prescient in understanding the fact that members of our community need help more now than in the past. It's with gratitude that we have members of our community, like Mark Shotwell, come and sit with us, especially after being at work all day. But this is an opportunity, and quite frankly, we set this time long ago when we started this program with the idea of getting as many people who might be interested to be able to attend after work. We didn't know we'd end up on Zoom. We had no idea about COVID. What we found, though, is that many of the topics that we've talked about has had an impact and been of value to people, and we hope particularly that this one will be. We start tonight by briefly touching on their mission, and the mission of Ritter Center is to prevent homelessness and improve the health and well-being of individuals and families who are homeless or low income by providing a range of culturally sensitive, easily accessible, and high-quality medical care and social services. Give some thought to these numbers. In 2015, 59% of the individuals that Ritter served were not homeless, but they needed help to remain housed. Of those 4,262 individuals at the time, 542 were children, 520 were seniors, 7% were veterans, and 20% had a disabling condition. Fully 18% of that number were victims of domestic violence. What I'd like you to do with those numbers is not memorize them, but in your mind, remember that these are members of our community. They don't fit any one size or style. They are a part of our community that at best we can call insecure in both their dwelling and their ability to get social services. Understand that Ritter didn't just happen, but that it dates back to the early 1970s and has simply grown as community needs and changes have frankly demanded that they grow. Tonight, I think we'll have an opportunity to hear how important Ritter Center and the services they provide are to keeping people who may be tenaciously holding on to either a roof over their head, a job, or some sense of well-being. When you combine that with the many services that Ritter Center offers, you can see that this goes far beyond just keeping them in place. It's a means of giving hope and aspiration to people. Without any further ado, I'd like to introduce Mark and tell him how grateful we are that he made time for us tonight.
All right. Can everybody hear me? Lori, can you just nod if you can hear me?
Yes, I can hear you. Can you hear me?
I can hear you. Great.
Okay.
So thank you so much to the Marin County Law Library and to our wonderful hosts for having me this evening and for all of you for joining tonight. So my plan is to present for no more than 30 minutes, and then we'll have the rest of the time for discussion and any questions that you may have. And what I hope to be able to cover with you tonight is to give you a little bit more information about Ritter Center and our different programs, and then to give some information about homelessness, the Housing First effort, and healthcare here in Marin County. So this is our wonderful staff at Ritter Center. As an executive director, I get to come do things like this and be a talking head about Ritter Center, but really it's these wonderful folks that every day give of themselves and their heart and their skills and their minds to be able to help people who are low income and people who've experienced homelessness in Marin County to be able to get back on track. So as was mentioned, we are a federally qualified health center, and specifically, HRSA, the Health Resources and Services Administration, funds health centers across the nation to be able to serve people who are low income, to ensure that they have high quality health care. And there are some specific designations for specific subpopulations that some health centers have. So Ritter Center has the designation of a healthcare for the homeless health center. And what that means is that we have special experience in being able to work with people who are precariously housed. And that basically means, you know, people who are really stretched on their income to be able to afford their housing. They might actually be doubled up or tripled up in an apartment to be able to afford the rent. And they're people that, you know, if one or two things were to go wrong, unfortunately, they might actually experience homelessness. And we also work with people who have already become unsheltered. And I'll talk more about our Housing First efforts, but we've been very happy that over the last 4 years, we've made a lot of progress along with our partners in Marin County at getting many of the people who've been long-term homeless in Marin County into housing. As was also mentioned, many people know Ritter Center because of our work with people who are homeless, but sometimes don't know that 60% of our clients are people who've never experienced homelessness. They're people who are low income. They may have Medi-Cal as an insurance. They may be uninsured and really need to have good medical care and a health center that wraps a lot of other services that I'll talk about tonight, because we really believe in treating the whole person at Ritter Center. And so we'll talk more about that. So as I mentioned, we are a health home for our clients. And what that means is that we are their primary care provider. We are the one-stop shop for them, so they can come here and they can get their medical care, behavioral care, help with benefits, case management, help with housing. We kind of have the full gamut of services. And then we have memorandums of understanding both with Marin Health and Marin Community Clinics for specialty services. So if somebody needs to see a cardiologist, if somebody needed to see a doctor about something with their spine, as examples, we have these collaborative relationships where we're able to get people in quickly for those services, and then have a collaborative, very tight relationship with those providers for good care for folks. This year, one of the things that we're very excited, we've been planning for this for a long time, and we've been able to launch our medical outreach team in the county. As you can imagine, there are people who are unfortunately not getting to health clinics, not getting to Ritter Center or the other health clinics in the county. And it's really important that we get out to folks and be able to provide some urgent care, to be able to treat things that they're dealing with, and use the street medicine van as a way to start to create relationships with people. Street medicine is a great thing to get services to people who aren't getting to clinics or won't come to a clinic, but it's not intended to be the long-term way in which we provide medical care. So we really look at this van and the team that works on it as a bridge to be able to start getting relationships going, start treating people's healthcare issues, behavioral care issues, help them start to get on applications for housing and things like that. And through our relationship, eventually get people linked with a health clinic where they can get a full range of services. That may be Ritter Center if we're the best health center for them, but we also provide services in West Marin, we provide services in South Marin. So in many cases, we may not be the closest health center to somebody. And so once we get them treated for their urgent needs and we get them motivated to be able to receive healthcare, then we would create that linkage with one of the local healthcare clinics like Coastal Health or Marin City Health and Wellness or Marin Community Clinics, if that's more appropriate for them. So this has a full-time medical provider and then a patient navigator, medical assistant that goes out and provides this at all kinds of places. You know, we go up on Mount Tam, we go over there to Bolinas, we go out to Marin Ship Park in Sausalito, we go out to Novato, pretty much anywhere. So if there's any place that you know of that people may be that aren't getting other medical services and you want to let us know about that, we'll get that on our calendar. This is our food pantry. So this was one of the very first services that Ritter Center started offering over 40 years ago. We are the largest food pantry in Marin County. We're open 5 days a week. We provide food for 350 households a week. And that food really makes a huge difference for people who are low income to be able to put nutritious food on the table and then not have to use their limited income to go buy that food. And then they can use that income for paying rent and paying to put gas in the car so that they can get to work, paying for clothing for their children, those types of things. So this really takes some of the stress and strain off of those families. We have a relationship with the San Francisco Marin Food Bank, and they're one of our major donors. But we also have a relationship with extrafood.org as an example. And we get a lot of those, you know, wraps and sandwiches and things that are still in really good shape, but the stores are starting to take them off the shelves because they're going to expire in a few days. And we can get those out to people right away. And who doesn't like a nice wrap or a nice deli sandwich, right? So we have just 3 staff that are employed by Ritter, but we have a bunch of volunteers that work in our food pantry. People who are volunteers in our food pantry are people who at some point were actually clients of Ritter Center or may still be clients of Ritter Center, and this is a way that they want to give back. We have a relationship with Dominican College. We have some longtime volunteers who've been doing this for decades, and it's one of their ways of giving back to the community. Case management services that we provide are really intended to help people who need some help coordinating the different services in their life. You know, I always think about, like, I have Kaiser, and it's actually fairly easy with Kaiser. Like, I just go to my provider and my provider refers me somewhere else in the Kaiser system. For people who are low income, there's a lot of different providers that they get in their life, right? You know, they get a social worker one place, they sometimes have a behavioral health care worker somewhere else. We work with people who have a lot of complex medical issues. So they may have like 2 or 3 specialists in their life. So case management is really that process of helping them weave together that network of providers that are in their lives and really kind of being the hub, thinking of all those different providers as the different spokes of their care. And we really become that hub to help them to coordinate that care and do things like go with people to their medical appointments. If any of you have ever been to a medical appointment, you might be like me. Doctors talk really fast. If you've got a bunch of things going on, they talk about a lot of things in a short amount of time. And boy, if you're not taking notes about all of that, and if you're not prepared when you go in for the meeting about what you want to talk with, you can walk out and be like, I don't remember what he said. So we become people's partner, their coach, to be able to prepare for those meetings. And then really to be able, after that visit, to be able to help them to follow up on all those things that the doctor asked them to do so that they can improve their health. Another really big part of what we do at Ritter Center is provide behavioral health services. Many of the people that we serve experience challenges with depression or anxiety. They may have more serious mental illness. We also have clients who experience challenges with substance abuse. So we have therapists that provide mental health counseling. I should say that all of our services, you know, if you have Medi-Cal or an insurance, we bill that insurance, but we don't not serve anybody because of their inability to pay. So if somebody doesn't have insurance and they can pay, they can still come to Ritter Center and they can still get the services. So those behavioral health services are really valuable for folks. We also have a substance abuse program, an outpatient program that we run with individual counseling and groups to be able to help people who are interested in starting to deal with their substance use and work towards recovery. We also have launched a small pilot of medication-assisted treatment to help people to have medications that help them to begin to start letting go of things like alcohol. And in 2022, we're going to launch a Suboxone program to help people to get off of opiates who've become addicted to opiates. Another thing we're really proud of throughout the agency is that we all got trained to be able to use Narcan, which is the medication that helps if somebody has taken too much opiates and they're experiencing an overdose. Narcan is the medication that first responders and doctors use to be able to bring people back. Anybody in the community can go through a very brief training and be trained to be able to administer Narcan. So we've done that with 100% of our staff. And over the summer, we had somebody who came to Ritter Center and they did not look good at all. And while they were checking in, they passed out and they were in the midst of an overdose, and our medical assistant and patient navigator administered Narcan. And before the first responders even got there to take the person to the hospital, the person was revived. And they went to the hospital to be checked out, and they were able to be released, and they were able to live another day so that we can help them to be able to hopefully let go of the opiates at some point. So it's really wonderful that we have that life-saving opportunity now. The other thing we help people with is that benefits advocacy. So helping people to get on Medi-Cal, helping people to get CalFresh, which is food stamps, helping people apply for Social Security benefits or supplemental security benefits if they qualify for those. So the benefits process is really an important one to make sure that people have access to those things that can really make a difference in their lives, but it can be complicated to go through that. So the person you see here with the mask here is Erica Fuyo, and she is a benefits specialist, and I would say she's a benefits expert. And she has lots of really wonderful relationships with people at the Social Security Department and social services. And so she can really streamline getting people on these benefits really quickly and helping getting their benefits reactivated if they've gotten suspended for some reason. And just, this is my last piece about Ritter Center, and then we'll talk about homelessness and health in Marin County. I love this picture and the smile on his face. Housing First is an evidence-based practice that we work with here at Ritter Center, and many of the nonprofits that we partner with are implementing. And what I mean by it being an evidence-based practice, you may already know this, but just in case. So an evidence-based practice means that it has been researched over and over again over the last and that research has shown that Housing First is able to help reduce homelessness by 85%, reduce hospitalizations for people by 85%, and reduce incarcerations for people by 85%. In Marin County, I'm very proud to say we have a 95% housing retention statistic that I love talking about, because that means that when we've gotten people into housing, 95% of the time, that ends homelessness permanently for those people. So this is an example of somebody here who got the keys to his place and had lived for decades on the streets before he had the opportunity to move in here. And it's just been a life changer. And you can just imagine, you know, if you have medical issues going on and you're trying to be able to deal with those things, but you're out on the streets, how do you take your medications? Where do you keep them safe? How do you eat nutritious food to be able to take care of yourself if you're out on the streets? Most of your time is spent on the streets trying to figure out how you're going to be safe and how you're going to move your belongings from one place to another. So when somebody gets into housing, it really opens up their world. It allows them to have a place in which many of us think about that our home is kind of the launching point, and it's also the safe place in the world that we can come back to at night And I know if everything's not going great in the world, when I come home, I feel secure and feel safe. And so we're very, very happy to be able to give that to people. And, you know, I love this line. I didn't make it up, but housing does end homelessness. And a lot of times people say, what's the solution to homelessness? And, you know, I don't want to be trite about this, because developing the housing stock to get everybody inside, it's a lot of work. But if you want to know what to do about homelessness, let's get people inside. Housing first, though, I really want to be clear. It's not a housing program. It's a clinical program. Getting people inside is the first thing that we do, but then we wrap around a very intensive team of medical providers, behavioral health providers, case managers, peer staff, to be able to work with people so that they can address all the challenges they have and learn how to live inside again. Because for many people, unfortunately, it's been a long time since they've had this opportunity. So those really robust supports are also what really makes a difference for folks. Just tracking my time. I'm doing good. So I'm going to keep and wrap up at 30 minutes. These are some statistics about homelessness in Marin. And you'll see that in 2015, the number of people who were experiencing homelessness in Marin, and this is a statistic that is looking at people who are experiencing homelessness of any kind, was 1,309. In 2017, it was 1,117, and by 2019, 1,034. I'll go to the next. So as of the 2019 point in time count, 1,034 people, as you saw on the last slide, were experiencing homelessness. That was a 7% decrease since 2017. Chronic homelessness, which is somebody who's experiencing long-term homelessness, usually many years, but definitely over a year, and also has a disability. So that's what's the definition of chronic homelessness, decreased by 28%. So we had a really big decrease in the chronic homelessness. In the point in time count is something that Marin County and all jurisdictions do every 2 years. It's part of the mandate from the federal government for anybody who gets, for any jurisdiction who gets money from the federal government to address homelessness, is that you need to do this point in time count. Outside of the COVID-19 pandemic, the point in time count is literally going out to every zip code, every street, every park, every place in the county. Volunteers, it starts at 5 in the morning. We go out, we canvass the entire county. And we literally count every single person who is experiencing homelessness on that night. Because of the pandemic, almost no jurisdiction across the nation has done the point in time count that way. And that's because you have several people in a car going out to do that counting, and that kind of close stuff we all know really well has been stuff that we couldn't do during the pandemic. So what we decided to do in Marin County in 2021 is that they did a vehicle count to count people in their vehicles. It's a somewhat simpler count to do, but a vehicle count is a very important count, because when people are living in their vehicles, it's usually a sign of people who've become homeless more recently. Again, that's not, I don't want to generalize. There are people who've lived in their vehicles for a long time, but the reason that this is thought to be a metric for people who are more newly homeless is that their vehicle is the last major belonging that they're hanging on to. And it's the last thing that's keeping them from literally sleeping on the streets. So unfortunately, in this time of the pandemic, there was a 91% increase in people living in their vehicles, from in 2019, 254 people to 486 people living in their vehicles. So this is a very, very concerning statistic. It's probably not shocking to people that you would imagine that during the pandemic, when lots of people lost their jobs, were out of work for a long time, weren't able to pay their rent, that unfortunately many people have had an increase in their homelessness. The other thing that we're very concerned about is with the ending of the eviction moratorium, many more households who are still housed are at risk of eviction if they haven't been able to access assistance to pay back the rent. Throughout Marin County, Ritter Center is one of the organizations that is providing what is called rapid rehousing assistance. And so if you know anybody who is in a situation where they're in housing and they can't pay their rent and they're going to lose their place if they don't pay their rent, send them our way. We have a lot of money in rapid rehousing money to help people to stabilize their housing situation. If people have just recently become homeless and they're not long-term homeless, we have other grants that can help to pay a security deposit, pay a number of months rent, support people to get back into housing quickly. So it's really important that we help those families, those households and individuals not become the long-term homeless on the streets. And if we can help them while they're in their housing to stabilize that situation, let's do that so they don't ever become homeless. So homelessness, probably don't have to say to this audience, but it's really a public health crisis. 29% of the individuals who are homeless in Marin have a chronic health condition. And I already mentioned many of the things that it's very difficult to do while you're on the streets to take care of those conditions. 25% have a physical disability, 42% psychiatric and emotional disorders, 35% with post-traumatic stress disorders, 14% with traumatic brain injuries, 28% with alcohol and drug use. Across the country in the Housing First efforts, there's been a lot of work to figure out what does it cost the systems to have somebody homeless on the streets? And those costs are the police, emergency medical services, the hospitals, the jails, public works folks. In Marin County, it costs $65,000 per year per person that is homeless on the streets. So Housing First, as I mentioned, is a huge part of what we're doing at Ritter Center. And it's a huge part of what Marin County as a whole is doing in what is called coordinated entry. So coordinated entry is another mandate from the federal government. And basically what they have said is, if you get money to end homelessness, you have to create a system in which you get to know every single person in the county that is homeless, and you assess their vulnerability. And you have to house the people who are the most vulnerable first, and then you keep moving down the list until you've housed everybody. So that's coordinated entry, and that's a process in which we use a particular, it's called the VI-SPDAT, which is a vulnerability index to determine people's vulnerability. We also look at other factors like their hospitalizations, and we name list, and we're really getting to know people by their name and by their story, so that we can prioritize them, house the most vulnerable, and continue to work to house everybody in the county. I've worked for 30 years in the behavioral health field, and for the last 25 years in the field of helping people who've experienced homelessness to get housed. And I will say, I came to Marin County 3.5 years ago when I started at Ritter Center, and Marin County has the highest level of partnerships and collaboration between nonprofits and county that I've ever seen. Usually what you see is you see counties and nonprofits, everybody's pointing at one another. Departments of the county don't want to take responsibility for housing because it's a hot button issue. The community is stressed out about it. Healthcare providers like me are very concerned about it. Politicians are very, very upset about it. So often what you see is people kind of saying, well, I think that's a social service issue and not a health and human services issue. No, I think it's a health and human services issue. Well, isn't it really a jail issue? And isn't it the nonprofits that should be doing this work? So that does not happen in Marin County. And I'm very happy to work in a system in which health and human services leads and says, homelessness is our issue. It's a healthcare issue and we are going to resolve it. But they've also been able to get partnerships from social services, the sheriff's office, the nonprofits, the people who work with elders, the people who work with children, to be able to have us all at the table working to end homelessness here in Marin County, because that's what it takes. No government alone, no one agency can end homelessness. So it really is working here. 400 vets and chronically homeless individuals have been housed since 2017. So in the last 4 years, we've housed 400 people. We've done that through whole person care and behavioral health care Housing First services. As I mentioned, 95% of those individuals housed have stayed housed. And here's some of those cost savings that we're talking about. 54% reduction in emergency medical service contacts, 85% reduction in police department contacts. Housing First this effort to put people in housing and have that program of staff wrapped around them costs $25,000 per person per year. So you remember on that previous slide, leaving somebody homeless on the street costs Marin County $65,000 a year. So for every person that we get housed and served through this program, we're saving $40,000 per person per year. One of the collaborations that's really important is this collaboration with the VA for serving the vets experiencing homelessness, because they provide some of the housing-based case management, but we're all very committed to ending veterans homelessness here in Marin. And then another great innovation is the Marin Housing Authority having a housing locator that develops the relationships with property owners, because this housing is almost all housing vouchers that people have where they rent apartments on the fair market. So getting those relationships with property owners that have apartments that they're willing to rent to folks is a really, really important job. And I'm very, very happy to say that there's been many property owners in Marin County who have not only stepped up with one apartment, but have continued to offer more and more apartments because they really see this as something that is good business for them, but it's also a great opportunity for them to be able to help somebody who's vulnerable get off the streets. I mentioned this already, the 28% reduction in chronic homelessness. Here are some of the kind of resource needs and challenges as we continue to work on this. Obviously, the cost of housing in Marin is quite expensive. And so it continues to rise, and as it does, it takes more money to house the same amount of people. And we've got more people we got to get housed. Disability payments for people who have a qualifying disability range about $1,000 a month. Rent for a one-bedroom apartment in Marin County averages $2,600 per month. So you can see without a housing subsidy, there's no way somebody with a disability would be able to afford housing on their own. So we really need to continue to work to sustain and increase these housing first services to serve more people. We know what works. We know how to end homelessness, but we need more of it to be able to get to everybody. The stock of housing is limited in Marin. And, in addition to helping people who've experienced homelessness, we really need more workforce housing and affordable housing. 60% of the people who work in Marin don't live in Marin because they can't afford to live here. And kind of, an emerging challenge for many seniors is that, people who are on fixed incomes. And so they are able to afford housing right now, but as those rents continue to rise, they're at risk. And, I've gotten calls from some seniors that have, they have some retirement money, but it's a finite amount and they know when it runs out. And they're trying to figure out, when I'm 70, I'm no longer going to have the little tiny safety net that I have right now. And so we need to have ways that we develop more affordable housing so that people who are long-term Marin residents, people who are seniors, people who are supposed to be in their golden years are able to continue to stay housed and not become at risk by winding up homeless. I'm sorry, I keep doing that. There's a pretty big gap between hospitals and skilled nursing facilities. So what we see, even in some of the people that we've provided housing for is that, in the homeless population, we have an aging homeless population, and many of those people are housed now. And now that they're in their apartments, we really want to figure out how can we help develop, assisted living facilities or more home health support so that we can keep people from winding up in skilled nursing facilities or the hospital as they continue to age and their health conditions continue to progress. So those are other things that we're continuing to work on. There is definitely a need for us to be thinking about these issues about seniors and others who are housed and people who could use either short-term rental assistance or may need long-term rental assistance to stay housed. We're not going to serve anybody well in Marin County, and we don't serve the overall county if we allow people who are currently housed and in many cases work their whole lives to get to retirement, but just are challenged by the economic realities in the Bay Area. So I think I kept to my word. I did. It's 6:40. I want to open it up if you all, I'll stop sharing my screen, but this is our website. This is my email here. And so if there's anybody that you can think of that might need any of the services and supports that I mentioned, you can direct them to our website, but you could also just send me an email and let me know. And you can have them reach out to me so that I can assist them at getting connected. And if there's something that we can do for them, we'll do that. If there's a service somewhere else in the county that they're eligible for, our staff are really, really savvy about what's available in the system and be glad to help with that, as well as any other questions that you may have. So I'll stop sharing my screen so that you don't have to look at that and open it up to see if there are any questions or things that you would like to have more information or discussion about.
Mark, can you tell us about some of the demographics of the folks that are utilizing the pantry system? And that's particularly acute right now, as I know that you folks are working as quickly as you can to bring it back into service after some unfortunate flooding.
Yeah, we as we all know, in the Bay Area, we had a massive storm a couple weeks ago, and unfortunately, with all the water that flooded the downtown area, our pantry was flooded with a foot of water. So, you know, as was just mentioned, we are working very, very quickly to get the construction done. We hope to be able to reopen the pantry next week. As far as the demographics, we do serve pretty wide demographics, and if you look at the demographics in Marin, the demographics in our pantry, you know, kind of follow along those lines. But we do have a high number of people from the Latinx community, a lot of households and families from the Canal that come to Ritter Center, again, because this is a really great resource for them to be able to stretch their budget. Many years ago, Ritter Center, which is now painted yellow, the Victorian was painted blue, and in the community of folks in the Canal, we were known as Casa Azul, the blue house. And so we serve a large percentage of that community, but we also, you know, we serve a lot of Caucasian, African American, a lot of seniors who are also working to stretch their budget. You know, we do have a significant Russian contingent of folks here in the county also, and in San Rafael, that utilize our pantry. So, you know, it is a mix of households. And then also, one of the unique things that we do at our pantry is that when you come in to get food, we don't ask your housing status. We just ask if you have access to refrigeration and cooking facilities. If you do, then we give you a bag of food that you would be able to go home, and you can put it in your refrigerator, and you can use your stove, oven, microwave, whatever, to be able to prepare a nice meal. If you don't have access that day when you come to the pantry for refrigeration and cooking facilities, then we have another bag of food that we can give you that you won't have to worry about that, and it'll be good, healthy food that you can eat. The reason that we ask that, as opposed to asking housing status, is that even people who are experiencing homelessness, often for a few days a week, or even sometimes a few weeks a month, they stay with somebody, they have a friend they stay with, they use some of their income to be able to get inside and have access to those things at certain times. So we really want people to be able to get the food that makes sense for them when they come in. So, and thank you for mentioning the flood. Very unfortunate thing. You know, we're grateful that we will get reopened. And I think mostly where our hearts are is just thinking about those families that need us and working fast to get things reopened so that we can be there for them.
Mark, can I ask a specific question that I'm intrigued about? In your benefits assistance program, I think you have listed that you have designated payees and help people with that. How many in our population would you say take advantage of that service through you?
So right now we have about 60 people that we're working with for representative payee. And we are actually hiring another staff member, so we'll have more capacity very soon when that position gets filled. And what the representative payee program is that for people who have Social Security disability benefits, Some people are required to have a representative payee help them to manage their money so that there's assurances that their basic needs are taken care of. So we have a contract with Marin County to be able to provide that service. So it is free of charge to the clients that we serve. Many representative payee programs charge a small fee, so we don't charge a fee for that. And then a case manager will work with them and develop a budget for their rent and their food budget, their personal spending money. And then they, in some cases, we just mail the check to their apartment on a regular basis. In other cases, people come down and pick up their checks on a weekly basis. And then when they have special needs or things like that, or if their PG&E bill goes up, they'll come in and they'll readjust their budget. We also have other relationships with many of the people who are on rep payee, so they are very familiar with us and we're very familiar with them. So we're able to really be supportive to them to ensure that that money that they get for their basic needs goes to that and helps to stretch it for an entire month, because it's a small amount of income, unfortunately, that people get, but a very important income to be able to ensure that they're taken care of.
Having a payee has proved pretty important in larger communities. For instance, the Tenderloin Housing Clinic, fully 25% or more could probably benefit from a designated payee relationship, but of course it is voluntary. And I think what's important for people to understand is this is so truly need-based that oftentimes the client may not even recognize the need.
Definitely. Yeah. Yeah, in some cases with some of the people that we serve in the rep payee, sometimes the Social Security Administration makes a decision that somebody's required to have a payee. And that happens sometimes because somebody has been taken advantage of around their money. And that may have happened a number of times. And so in some cases, a physician may actually write to the Social Security Administration with serious concern about somebody's ability to manage their own money, taken advantage of. And so a representative payee program can help with that to ensure that, somebody who may not have good intentions can't take advantage of somebody and their money. Another example is that for individuals who do have a diagnosed substance use disorder, they are required to have a representative payee if they receive disability benefits. There are not disability benefits for having a substance use disorder, but many of the people that we serve have co-occurring mental illness and other health conditions, and so they have disability benefits because of that. But if they do have that co-occurring substance use disorder, then they're required to have a payee. And, probably don't have to stay it, but, for obvious reasons, right, is that the federal government wants to make sure that people's housing, food, basic needs are taken care of, and that money's not going to fuel their addiction and unfortunately then leave them without that money to take care of needs. I think you're right. Sometimes people are not that insightful about, their need for that. But in many cases over time, because the payee program does allow them to stretch that money all month, those basic needs are taken care of, they continue to be housed, they continue to have money for food. Many people actually do become not just tolerant of it, but actually grateful for the program because it helps them to be able to stretch that. Sometimes the job of being a payee is to hold a boundary with somebody around money that they may be a little mad at us that day because we're going to make sure to protect money for rent, and we're not going to give them the money that they're feeling like they need for something that's probably not going to be good for them. We do that as much as we can with compassion and grace and understanding, because addiction is a big challenge for some of the folks that we work with, and it's hard when they're craving for those substances. But we just keep the eye on the prize with them, that we're going to keep you housed, keep you having your money, and help you to address those things. And many of those folks eventually seek recovery, but during that period of time where they're not there, those can be some big challenges. And sometimes mental illness causes people to not have good insight around something, around their money, or not be able to make good decisions about how they spend, or even just have cognitive challenges with balancing a budget and paying bills and things like that. And so it can be helpful to have somebody to help you manage that.
Mark, this is Lori at the Law Library. I'm interested in, you mentioned that you have someone that does benefits advocacy.
Mhm.
So if somebody came into the library, that law library, with an issue,
Mhm.
one of those types of issues, could I send them to Ritter Center?
Yes,
Do you have
absolutely.
do you have income requiremements? I mean, like, do they have to be below a certain income level?
So, so all of our services again are available to people regardless of their ability to pay. Um, as far as our medical and behavioral services like therapy, if people don't have insurance, we have a sliding scale, right?
Okay.
And that sliding scale, is based on income. So if somebody has a higher income, then there's a sliding scale based on that. But that sliding scale and that fee is different than whether somebody actually pays us, right? So we're required to establish that fee and we're required to try to get them to pay us. But sometimes people who are low income, even if the sliding scale is sliding to $2, they don't have $2 in their pocket, right?
Right.
Those are for medical and therapy services. For benefits advocacy, there's no charge for those services. So if somebody needs that support and assistance, and again, the kinds of benefits that we're really helping people with are things like Social Security income, CalFresh, Medi-Cal, sometimes with their Medicare benefits. And we also do have a program working with people who are living with co-occurring mental illness and substance use issues to help them apply for Social Security. And that's called the RISE program. It's, I'm not gonna be able to say what it stands for. Rapid Increase in Social Security. And the E stands for something great. I can't say it right now. But that's a program through Marin County that we then work with people, because there's a lot of documentation that you got to get together, and you've got to coordinate with your medical providers to get information to the Social Security Administration for that evaluation if you are disabled and if you qualify for those benefits. So people who are dealing with mental illness and substance abuse challenges, that mental illness might be the reason that they qualify, but it's a pretty complicated system. Social Security is a very, very large bureaucracy with a lot of rules, and getting that stuff right can be challenging for somebody who's trying to apply for those benefits. So we have case managers that work with folks around that to really walk them through the process. And then we have a weekly meeting with Social Security here in Marin County where we can address any challenges that are going on, and they what else is needed in the packet, so that we can try to decrease that amount of time from the initial application to people getting approved. So again, you can just either refer them to my email or to the, and on the website, there's lots of information there about how to access different services and different phone numbers to.
Great, thank you very much.
Yeah.
Any other questions?
Mark, could I ask a quick question about a program? Could you tell us a little bit about your Custody to Community program?
Sure, thank you for asking. Yeah, our Custody to Community program, that's another program funded by Marin County. And individuals that are living with mental illness and substance use disorders often get picked up and go to the county jail for kind of small end things, right? They slept in a place that was a private property and they get arrested for trespassing, or they get picked up for public intoxication or things like that. So unfortunately, there kind of becomes this revolving door with the county jail, because these are really low end offenses, so people don't get held for very long. But one of the things that happens when you go into jail that is unfortunate is that if you stay in for a full calendar month and you were on Medi-Cal benefits and you were on, say, general assistance and SSI or Social Security benefits, your benefits stop after you've been in a full calendar month. And they can get restarted, but you've got to get the release of custody paperwork to the right places to be able to get those benefits restarted. So Custody to Community, what we do, we have case managers that we get assigned to people when they're in the jail. We work with them and we develop a plan for how we're going to help them land well back in the community, because those kinds of things, not having your benefits set up, not having a safe place to stay, not knowing where your next meal is going to come from. Those things, when people get out of jail, cause them to have challenges that unfortunately sometimes lead to them getting into trouble again, and then they kind of like wind up back in the jail. So the goal is to get them these services starting in the jail, develop a good plan, and then we continue to follow them in the community so we can really break that cycle for folks where they're on that revolving door. It's not so much the case here in Marin County, because Marin County is pretty good at not keeping people for long periods of time. But unfortunately, across the country, what we see is the largest mental health system is the jail system, because people wind up going in and out because they're not getting the right services in the community to be able to help them to break that cycle. So that's the intention of that program. And we get referrals directly from the Health and Human Services staff that work there at the county jail of people who they've been seeing, kind of the frequent flyers, to be able to help those folks not have to have that experience over and over again. And it's not good for the system, right? So if we can get people out, I think I'm speaking to the law library, I think I'll agree that, there are people who commit serious crimes that are really dangerous to the community, where maybe being in jail for a while might be what's necessary, but, occupying a lot of time and energy because somebody's been experiencing homelessness and mental illness is not really what the criminal justice system is there for. So we want to get people the right kinds of help, the right kinds of treatment for those things, rather than sitting in jail. Any other questions?
I'd like very much, as we enter this holiday season, to ask about programs that Ritter Center provides and how interested folks could help donate towards them.
Sure. Yeah, the end of the year is a big time for us. So the very next thing, and this is one of the reasons why we've got to get that pantry reopened, is that we got Thanksgiving coming up, and we have a very, very large turkey and all the fixings giveaway that we do. That's been a long time collaboration with the San Rafael Police Department and the Marin County Sheriff's Office, that every year those two entities compete for who's going to give us the most turkeys. But they both long-term donors of that, and we playfully play them off one another. It's like, oh, they're giving us 60 this year, you guys better step it up. We get those turkeys, and then the food bank provides, along with some of the local grocery stores like Good Earth and United, provide us a lot of the fixings for folks. And so those families that come, many other times during the year to get nutritious food can have that wonderful meal on the table come Thanksgiving. We also have a number of other holiday programs. We have what we call our family to family program, where we have families that donate to be able to purchase gift cards for families. Historically, they actually went out and purchased gifts. But that's one of the things during the pandemic, is that going out and purchasing the gifts and us collecting all those donations is challenging. So last year, what we did, and we're doing it again this year, is instead had people donate so we can get those families gift cards so that they can buy gifts for their children and have gifts around the holidays. The two other programs we have is what's called Adopt a Senior and Adopt a Person Experiencing Homelessness. And that's so somebody who's a senior, who's low income, who might not otherwise get gifts, and somebody who's experiencing homelessness who might not get gifts also gets adopted by people in the community to ensure that they get gift cards to be able to purchase gifts. And the last thing that we have going on is we have a big holiday dinner that we provide. Normally, outside of COVID times, and I can't wait until it's over so we can get back to it, we do a really huge feast at a church in San Rafael, and we have over 100 people that have experienced homelessness at some point that come, and many other people from the community, and then all of our staff and board and many volunteers from the community put together this wonderful meal for everybody, and we have music and everything. So we're keeping the food, we're keeping the music, and we're keeping the excitement, but we're doing it as takeout rather than all getting together in the dining room because of COVID. And so we did that last year, and it was well received. So that's coming up also. So on our website, there is information about all of these different programs, and there is a very easy system there for how to donate. So if anybody is interested in supporting those personally, or if you would be willing to share that information with people, because all of the programs that I just mentioned, as well as many other things at Ritter Center, are supported not only through some of the grants that we have, but through people in the community like yourselves who have chosen to listen to me and learn about Ritter Center and who decided that they wanted to donate. So I'm very grateful to all of you for providing the opportunity for us to come and talk tonight. And thank you for your wonderful questions and your interest.
One last question, if I might,
Sure.
and back at you with the kind things you're saying. If someone would like to volunteer at Ritter Center, what kind of things can a person do as a volunteer in your organization?
Sure. So we, the really big thing that we have is the food pantry opportunities, and that, you can do administrative things to help with that process, or literally help to put together the food bags for people that we hand out. Recently, we had somebody that reached out to us, and she has an accounting background, and she was really interested in assisting in our accounting department. And so we linked her with our accountant, and that's been a great opportunity. We had an architect at some point that offered to provide some help when we were thinking through restructuring of. There are a lot of opportunities, and just we are currently in a process of putting an application in for VISTA volunteers. And when that happens, what we're going to use our VISTA volunteer for is to develop a much larger volunteer program at Ritter Center, where we could also have people help us in our medical services and our case management services. So coming soon, stay tuned for that. But if you or anybody you know is interested, you can go to the website. There's information there about who to contact. And again, I don't want people to get confused. We try to make the website easy, but the simplest thing is probably just email Mark Shotwell at rittercenter.org or mshotwell@rittercenter.org, and I'll connect you with Jorge, who manages our volunteers right now.
Do we have any other questions tonight?
I don't see any other questions. There's a nice thank you from Barbara Alexander. Thank you for all you do at Ritter Center. Thanks for the program tonight.
Thank you, Barbara. Thank you, everybody.
Mark, we certainly appreciate having you. We hope we won't be strangers now, and that this is the beginning of building our relationship with Ritter Center. You're a wonderful resource.
Well, thank you very much. And I really feel honored to have the opportunity to come here. So thank you very much.
Thank you, Mark.
Have a good evening, everyone. May I remind you that our next Lawyers in the Library, I believe, falls on, is it November 18th, Lori?
Yes, it is. We only have one in November. It's on the Thursday, November 18th.
And for those of you that are interested, we're fortunate for next month's guest. We're having the legal aid of Marin County come and visit us. So we hope you'll attend then. And again, we appreciate our interest from our law library patrons. We particularly appreciate our organizations like Ritter Center, who made time after a long and busy day to come and visit us tonight. Thank you so much, Mark.
Thank you.
Have a great evening, everybody.
Thanks.